Taking amlodipine, Losartan, or Lisinopril for blood pressure. Here's what many seniors don't know. Many individuals taking daily blood pressure medication, such as amlodipine, Losartan, or Lisinopril, may not fully grasp the intricate ways these powerful drugs function within their bodies. It's not merely about following label instructions or the brief advice from a pharmacist. A deeper understanding of how these medications work, their potential to cause issues under certain circumstances, and the subtle warning signs that distinguish minor discomfort from serious medical emergencies is crucial. Often, even well-informed individuals hesitate when asked about their medication's specifics, revealing a common gap in knowledge. These medications are not benign supplements. They significantly alter daily bodily functions, impacting the heart, blood vessels, and kidneys. Unfortunately, millions of seniors take them routinely without a clear understanding of what to monitor, what to avoid, or when a seemingly ordinary symptom might be their body's urgent plea for attention. This information aims to bridge that knowledge gap, empowering individuals to feel safer, more confident, and less susceptible to being caught unprepared by their medication. One compelling illustration of this knowledge deficit involves a situation with a 74-year-old gentleman, a retired engineer who meticulously followed his medication regimen. When a new medication was added to his daily routine, he assumed it would be similar to his existing ones, a common misconception that nearly led to significant health complications. Within months, he experienced noticeable swelling in his feet, making it difficult to wear his regular shoes, and his legs felt heavy by the afternoon, causing him to limit his physical activity. He expressed concern about his circulation and began researching heart failure, unaware that the underlying issue was a predictable side effect of the newly prescribed medication, one that had not been fully explained to him. This incident highlights that while some blood pressure medications might seem similar, their distinct mechanisms of action lead to different potential side effects. For instance, one medication works by relaxing blood vessel walls, another by inhibiting an enzyme that constricts vessels, and yet another by blocking a receptor in a related system. These differences, though subtle, influence how the body responds and what symptoms individuals should be aware of, preventing the misinterpretation of bodily signals through a generalized lens. In this particular case, the swelling was not a sign of heart failure, but a direct result of how the medication relaxed arteries more than veins, causing fluid to accumulate in the lower legs. Once this was correctly identified and addressed, the individual's mobility and comfort were restored within weeks. This underscores the importance of recognizing that the name on the medication bottle represents a specific class with unique characteristics and potential outcomes. The swelling experienced in the legs and ankles, particularly common with one type of blood pressure medication, is a frequently misunderstood side effect. This occurs because the medication effectively relaxes the small arteries in the legs, allowing more blood to flow in. However, the veins responsible for returning blood to the heart do not relax to the same extent, creating an imbalance. This leads to increased pressure within the small vessels of the ankles and feet, forcing fluid into the surrounding tissues. The consequence is puffiness, indentation marks from socks, shoes becoming too tight, and a sensation of heaviness in the legs. It's crucial to understand that this is not typically due to excessive salt intake, kidney failure, or the onset of heart failure, but rather a direct physiological response to how the medication influences blood vessel function. The real danger arises not from the swelling itself, but from the incorrect responses it elicits. Some individuals may stop taking the medication without consulting their doctor, inadvertently allowing their blood pressure to rise again. Others might mistakenly reduce their fluid intake, believing they are retaining water, which can be hazardous, especially when on this type of medication. A common approach is to endure the swelling for months, leading to a reduction in daily activities and a diminished quality of life, all unnecessarily. The recommended action is to discuss leg swelling with a healthcare provider. This allows for potential adjustments, alternative medications, or strategies like elevating the legs or modifying the dosage timing, all of which can make the side effect much more manageable. Without communication, these solutions remain inaccessible. Another notable side effect associated with a different class of blood pressure medication is a persistent dry cough. This cough is characterized by a tickle at the back of the throat, often worsening at night, and it typically doesn't respond to common cough remedies. The deceptive nature of this side effect lies in its delayed onset. While some individuals develop it within the first week of starting the medication, others may experience it months later. By then, the connection to the medication often goes unnoticed, leading individuals to attribute it to allergies, lingering cold symptoms, or even acid reflux. For example, an avid gardener initially believed her cough was due to seasonal pollen. Despite using antihistamines, an air purifier, and undergoing a chest X-ray, the cough persisted for 6 months, disrupting her sleep and causing fatigue and irritability. It wasn't until she revisited her medication history that the likely cause was identified: the blood pressure medication she had started months prior. Upon switching to a different class of medication that targets a similar pathway but does not cause this type of cough, the bothersome tickle vanished within 2 weeks, resolving a problem that had plagued her for nearly a year. It is critically important to distinguish this common, albeit annoying, cough from a life-threatening emergency. If you are taking this specific type of medication and experience swelling of the lips, tongue, face, or throat, especially if swallowing or breathing becomes difficult, seek immediate emergency medical attention. This condition, known as angioedema, is rare, but can rapidly compromise your airway. The distinction between a nuisance cough and a life-threatening swelling is paramount and should be memorized. For individuals taking another common blood pressure medication, a significant danger can arise from seemingly innocuous lifestyle choices that increase potassium levels. This medication, like another mentioned, works on the body's blood pressure regulation system, and one of its effects is a potential rise in blood potassium. While this is usually manageable with proper monitoring, combining it with certain dietary habits can be problematic. A surprising source of high potassium is often found in products marketed as healthier alternatives, specifically salt substitutes. Many low-sodium options replace sodium with potassium chloride. When someone advised to reduce salt intake begins using these potassium-based substitutes liberally, they can inadvertently elevate their potassium levels to a point that affects the heart's electrical system. This elevated potassium doesn't always present with obvious symptoms. It can manifest subtly as unusual muscle weakness, persistent fatigue, leg cramps, tingling in the hands, or an irregular heartbeat, and sometimes there are no preceding symptoms at all. This combination of medication and dietary choices can create a gradually worsening problem that is entirely preventable with awareness and medical guidance. Furthermore, certain electrolyte powders, meal replacement shakes, and sports recovery drinks can also contribute to elevated potassium levels, and their potassium content is often overlooked. A critical scenario that warrants attention, particularly for seniors, concerns how these medications behave during illness. Even a common stomach bug, characterized by vomiting, diarrhea, loss of appetite, or significant fluid loss through sweating in hot weather, can dramatically alter the effectiveness and safety of blood pressure medication. In a dehydrated state, the same dose of medication that was appropriate for a well-hydrated body can lead to dangerously low blood pressure, increased strain on already vulnerable kidneys, and symptoms like dizziness, weakness, or faintness. The medication itself hasn't changed, but the body's internal environment has, creating conditions for which the drug was not designed. This emphasizes the need for a pre-established plan with a healthcare provider, detailing what to do with blood pressure medication during periods of illness, including when to hold a dose, when to seek medical advice, and which symptoms warrant an immediate visit. Without such a plan, a significant safety gap exists. Many individuals, however, are not proactively given this crucial information by their prescribing doctors and rarely ask for it. The interaction between common over-the-counter pain relievers and certain blood pressure medications is another area of potential risk that often goes unaddressed. For instance, regularly taking ibuprofen or similar non-steroidal anti-inflammatory drugs, NSAIDs, for pain, especially when combined with specific blood pressure medications and diuretics, can significantly reduce blood flow to the kidneys. This risk is amplified in situations of even mild dehydration, substantially increasing the likelihood of kidney injury. This common scenario is frequently overlooked because individuals do not perceive over-the-counter pain relievers as serious medications comparable to prescription drugs. They are simply seen as remedies for aches and back pains. However, the kidneys do not differentiate between prescription and over-the-counter medications. They respond to the chemical compounds. Therefore, individuals who routinely use anti-inflammatory pain medications for conditions like arthritis or back pain and are also taking certain blood pressure medications should have a detailed discussion with their doctor about safer alternatives. Options like acetaminophen, topical treatments, or physical therapy may offer relief without the same kidney risks. Dizziness, often dismissed as simply standing up too quickly, can be a significant indicator for seniors on blood pressure medication. That momentary feeling of lightheadedness or the world tilting can, for older adults, be sufficient to cause a fall, leading to fractures that can have long-lasting, debilitating health consequences. While blood pressure medications are working to lower blood pressure, a rapid change in position can temporarily reduce blood flow to the brain. Simple adjustments like rising slowly, sitting on the edge of the bed before standing, or holding on to stable objects can help mitigate this. However, if dizziness is a regular occurrence, persists beyond the initial weeks of medication, or involves near fainting, it warrants a thorough medical review. The dosage may need adjustment. The combination of medications might require reassessment, or hydration habits might need modification. Ignoring persistent dizziness can pose a substantial risk. Managing blood pressure medication can also be a source of anxiety due to a misunderstanding of what constitutes a normal blood pressure reading. Blood pressure fluctuates continuously throughout the day due to various factors like sleep quality, caffeine intake, pain, stress, or even speaking loudly before a reading. A single high reading on one occasion does not automatically mean the medication is failing, nor does a single low reading after dehydration necessarily indicate the medication is too strong. What is truly important is observing the pattern of readings over time, taken consistently under similar conditions. The same arm, at the same time of day, after a period of rest, and without talking. Reacting emotionally to isolated readings by taking extra doses or skipping doses can lead to poor decision-making. Instead, consistent monitoring and logging of readings, which can then be discussed with a healthcare provider, provide a far more useful picture than a single alarming number. This methodical approach reduces anxiety and facilitates more informed conversations about treatment. The consistent, steady presence of medication in the system is vital for blood pressure management. These are not rescue medications meant for reactive use. They are designed to maintain a stable chemical environment over time. Disruptions to this consistency, such as missed doses, double doses, or erratic timing, can lead to fluctuations in blood pressure that may create the impression that medication isn't working, when in fact, the issue lies with the pattern of administration. If a dose is missed, the general advice is to take it when remembered, unless it is close to the time of the next scheduled dose, in which case it should be skipped. It is crucial to avoid taking 2 doses to compensate for a missed one. However, the most reliable approach is to obtain specific instructions from a healthcare provider regarding missed doses, and to document this guidance for easy reference. Ultimately, the most effective blood pressure medication is not necessarily the one that achieves the lowest number on paper, but rather the one that can be taken safely, consistently, and comfortably within the context of an individual's overall health, lifestyle, and other medications. A medication that performs well in clinical settings but leads to sleep disturbances, significant swelling that limits mobility, or persistent dizziness that causes fear of falling is not truly successful for that person. Side effects are not a sign of personal weakness or oversensitivity. They are valuable information communicated by the body, indicating that the current treatment might not be the best fit. Many seniors endure side effects in silence, believing they have no alternative. But this is often medically unfounded. There are almost always options, including dosage adjustments, changes in timing, alternative medications, or combination therapies. But these can only be explored if individuals vocalize their concerns. Suffering quietly through unpleasant side effects can lead to the eventual abandonment of medication without medical consultation, which carries its own set of risks. Open communication with healthcare providers is essential, and individuals are encouraged to use their voice to ensure their treatment plan is truly effective and comfortable. In summary, if you are taking amlodipine, be aware of potential leg and ankle swelling and report it rather than enduring it. 4. Those on lisinopril recognize a persistent dry cough as a possible side effect, and be vigilant for the emergency signs of throat or tongue swelling. If you are on Losartan, watch for symptoms of high potassium, review your salt substitute usage, and ensure you have a sick day plan. For all three medications, rise slowly to prevent falls, monitor your blood pressure consistently, consult your doctor before combining them with anti-inflammatory pain relievers, and never discontinue them abruptly without medical guidance. Taking the time to learn about your medication is a sign of taking your health seriously, and this knowledge provides clarity, transforming a prescription into a truly understood treatment plan. Sharing this information can help others avoid potential harm.